Now we come to our first topic, which is cestodes. There are two sections in parasitology. We'll be starting with the helminths. We'll go to protozoology later on. When we start helminthology, and there are two slides that I want to discuss before we move to the cestodes, so that you have some basic introduction of what to expect in these classes. So helminths are multicellular, bilaterally symmetrical parasitic worms that cause infection in humans. There are two phyla in this topic. First is phylum Platyhelminthes, in which we'll see flatworms, which are dorsoventrally flattened. Another is phylum Nemathelminths, in which we have roundworms. Nema means thread, platy because they are dorsoventrally flattened. Now flatworms are further of two types. We have a class Cestoda and class Trematoda. Cestoda means tapeworms which are tape-like in appearance, and trematodes means flukes. So these are some of the differences between these three types of helminths. Cestode, just for the sake of remembering, you can remember that cestodes are like sellotape. Cestodes, sellotape. So they are tape-like. Trematodes are leaf-like. So tree में leaves होती हैं. Trematodes are leaf-like. And nema means thread. It's fairly simple. Nematodes are the roundworms or the thread forms. These differences are very easy to understand. We'll not be spending much time in them. But the most important thing that you need to remember is the life cycle. I am going to generalize something in this slide only, and I expect you to remember this throughout the helminthology section. Cestodes require two hosts, except for the one that is largest cestode. It will require three hosts. This is also a way to remember. It's not because it is large that it requires three hosts. Cestodes again, उनको सिर्फ दो होस्ट चाहिए होते हैं अपना लाइफ साइकिल कंप्लीट करने के लिए, एक डेफिनेटिव होस्ट, एक इंटरमीडिएट होस्ट एक्सेप्ट डायफाइलोबोथ्रियम लेटम. ये लार्जेस्ट टेप फॉर्म है, तो ऐसे याद रख लो, इसलिए इसको एक एक्स्ट्रा चाहिए. इट रिक्वायर्स थ्री होस्ट. whereas Hymenolipis nana is the smallest cestode या smallest tapeworm है, तो इसका एक से ही काम हो जाता है. It requires only single host. Trematodes में आपको याद रखना है that they require three host except schistosomes. Schistosomes की exceptions और जगह भी आएंगी. Schistosomes require only two host. इसमें एक कम चाहिए, और ये बहुत इंपॉर्टेंट है इसकी लार्वल स्टेजेस को याद करने के लिए. हमने आगे ट्रेमेटोड्स में पढ़ेंगे इसको अच्छे से. एंड इन नेमेटोड्स दे जनरली रिक्वायर ओनली वन होस्ट एक्सेप्ट फाइलेरियल वर्म्स एंड ड्रैकनकुलस. सो this is something I wanted you to remember at this stage. Now we come on to cestodes. There are only four cestodes that we will be discussing, and these four are the most important cestodes of medical importance. First is Diphyllobothrium latum. Second is Taenia, in which we have Taenia solium and Taenia saginata. Then we have Echinococcus, in which we have Echinococcus granulosus and Echinococcus multilocularis. And last is Hymenolipis nana. We have already discussed that they require two hosts except D latum, which is the largest one, it requires three, and H nana, which is the smallest one, it requires only single host. Definitive host, as we have already discussed, is man in case of all the parasitic infections of medical importance except Echinococcus and Taenia, not exactly Taenia, cysticercosis. When we discuss cysticercosis, it is an infection which occurs in humans after ingestion of eggs of Taenia solium. So for this particular entity, man will act as an intermediate host. Now the intermediate host for rest of the organisms will be discussed as we discuss the life cycle, and I also went on to enumerate some of the characteristics of the eggs of these four cestodes. Let's begin with Diphyllobothrium latum. It is the largest tapeworm inhabiting the small intestine of man. Its scolex has two slit-like sucking grooves, which are known as bothria. Hence, the name of this organism is Diphyllobothrium. The eggs of this parasite are operculated. They have a lid. It has a size of 65 into 45 micron, and there is a oncosphere which is present in the eggs of all the cestodes, and they all have 3 pair of hooklets. Vitamin B12 deficiency is an important clinical feature of this infection, and vitamin B12 deficiency is also seen in case of Fishelopsis buski infection. Fishelopsis buski is a trematode. We'll be discussing this later on. Now on the left you can see the actual life cycle of Diphyllobothrium latum. As we have already discussed, it requires 3 hosts. So definitive host is man, and there are 2 intermediate hosts. First is cyclops, second is fish. So this infection is acquired after ingestion of infected fish containing plerocercoid larva. On the right I have simplified this entire life cycle, so those who find it difficult to see a complex diagram can just simply focus on to the right side. Man will harbor the adult parasite which will release eggs, and Diphyllobothrium latum is notorious to lay millions of eggs per day. It can release million of eggs per day, and once this egg enters water, the egg will hatch out and a Coracidium larva will come out of this egg. This Coracidium larva is ingested by Cyclops, which is the first intermediate host, where the Coracidium will further undergo development to molt into a procercoid larva. This procercoid larva is present inside the Cyclops, and when a fish ingests this infected Cyclops, the procercoid larva will infect this fish, where it will further undergo development to form the plerocercoid larva. And when man eats such an infected fish, the life cycle is completed and infection propagates to a new host. Clinical features. For all the parasitic infections that we are going to discuss in cestodes, you need to remember that the clinical features are exactly similar. How similar? First, either the infection will be asymptomatic or there will be non-specific abdominal symptoms in case of all the cestodes. So number 1 is asymptomatic. Either the infection is asymptomatic, there are no symptom, कोई symptom नहीं होंगे, या फिर non-specific symptoms होंगे such as pain abdomen, nausea, diarrhea. And in addition to that, in case of Diphyllobothrium latum, there could be pernicious anemia because of vitamin B12 deficiency. That is the separate thing that is seen only in case of Fishelopsis buski and Diphyllobothrium latum infection. For diagnosis, we can do stool microscopy, in which we will be able to see eggs of Diphyllobothrium latum, which will be bile stained, so they will be brown in color. They will be 65 into 45 micron in size, so they will be oval in shape, and they will be having an operculum. Second is coproantigen test. Antigen is present in the stool, so we can detect this antigen to establish diagnosis. For treatment, we have to give vitamin B12 supplementation because of excessive loss of vitamin B12 to the parasite, and praziquantel in a single dose of 25 mg per kg body weight is sufficient to treat the patient. For preventing this infection, either the fish should be properly cooked before eating, or in case someone intends to eat a raw fish, then deep freezing of this fish for 48 hours is recommended, in which we store the fish at -10 or lower temperature for at least 48 hours. Second is tinea. Tinea are further of 2 species and they have 2 important species that infect humans, Tinea solium and Tinea saginata. Tinea solium causes pork tapeworm because it is acquired from consumption of pork, whereas Tinea saginata is known as beef tapeworm because it is acquired by consumption of beef. It is global in distribution, and the magnitude of infection might not be that high, but it is important to remember that cysticercosis or neurocysticercosis, to be more precise, is the commonest cause of adult onset epilepsy. जिन भी लोगों को adulthood में epilepsy होती है उनमें से 70% से ज़्यादा को cysticercosis की वजह से epilepsy होती है. These are various differences between adult worm of Tinea saginata and Tinea solium. जिसका नाम बड़ा उसकी लेंथ भी ज़्यादा बड़ी. All these things that I'm going to enumerate is just a way to memorize it. It is not because its name is longer, hence it is longer. Tinea saginata नाम ज़्यादा बड़ा है तो ये ज़्यादा लंबा होता है. सोलियम का नाम छोटा है, its length is smaller. Second, you can also memorize this way that saginata is acquired from beef or cow. So cow बड़ी होती है, pork या pig छोटा होता है. Accordingly length भी इनकी आप correlate कर सकते हो, just for the sake of remembering. Scolex, जो बड़ा होगा उसका scolex large, जो छोटा है length में उसका scolex छोटा. head जो होता है वो छोटा होगा उतना. ठीक है. neck long किसकी होगी? जो बड़ा है दोनों में से साइज में. short किसकी होगी? जो छोटा है. प्रोग्लॉटिड्स जो सेगमेंट्स होती हैं वो किस में ज़्यादा होंगी? जो बड़े वाला फॉर्म है दोनों में से, सो सेजिनेटा. देन जिसकी प्रोग्लॉटिड्स बड़ी हैं तो उनकी एक्सपल्शन जो सिंगल होगी क्योंकि वो ऑलरेडी बहुत बड़े साइज़ की सेगमेंट है उसकी. ऐसे आप याद रख लेना. वेयर इन केस ऑफ टीनिया सोलियम द प्रोग्लॉटिड्स आर एक्सपेल्ड पैसिवली इन चेन्स ऑफ 5 और 6. ठीक है. यूट्रस आर मोर इन नंबर इन केस ऑफ सेजिनेटा, दे आर फ्यूअर इन केस ऑफ टीनिया सोलियम. वेजाइना इज प्रेजेंट इन सेजिनेटा, एब्सेंट इन सोलियम. Then testes are more in number in case of saginata, they are lesser in case of solium. Then eggs are not infective to man. This is important. You need to remember that only Tinea solium eggs are infectious to man. The rest of the points we have already discussed. This is the life cycle of Tinea saginata. Fairly simple and straightforward. An infected man will lead to excretion of eggs in the feces. The eggs are bile stained, so they are brown in color, and their characteristic feature is that the outer embryophore is radially striated. This is an important point that you need to remember. So eggs are released in the feces. Now, while the cattle is grazing the farms, these eggs are ingested by the cattle. So as a result of that, the oncosphere will come out of the egg in their small intestine, where it will get attached to the duodenal mucosa. And sorry, I apologize. The oncosphere is released in their duodenum, from where it will via the systemic circulation reach the striated muscles, where it will form the Cysticercus bovis larva. Now this infected beef is consumed by man to complete the life cycle. Similar life cycle is seen in case of Tinea solium, except the fact that instead of a cattle, the intermediate host will be a pig. Also, here we have discussed that eggs are infectious to man. So consumption of certain vegetable and food items by vegetarian people can also lead to infection, because if the eggs are ingested, they'll again form Cysticercus cellulose larvae in human muscle, or they may go to other important vital organs such as brain, optic nerve, and cause related symptoms. Clinical features, again, as long as it is an intestinal infection, the symptoms are similar to Diphyllobothrium latum infection. It will either be asymptomatic or there will be non-specific abdominal symptom that we have already discussed. Laboratory diagnosis will be discussed in detail in next slide. Treatment again is praziquantel, single dose 25 mg per kg body weight, And if a person is having neurocysticercosis and needs treatment, then we can either give praziquantel in case of heavy infection, or we can give albendazole along with anti-epileptics so that a patient does not develop seizures or epilepsy. To prevent this infection, meat products should be consumed carefully. Vegetables that are grown in soil or at ground level should be thoroughly washed before consumption. The use of sewage treated water for irrigation should be done carefully, and sanitation measures need to be improved. Certain vegetables and food items should be avoided. For example, cabbage, lettuce, or even that pudina chutney, green chutney should be avoided. For laboratory diagnosis, we can do stool examination in case of intestinal infection, where we will be able to see eggs or segments of parasite proglottids, and also antigen testing can be done. Then second is serodiagnosis. We can do ELISA to detect antibodies in the human blood. For molecular diagnosis, the collected specimen can be tested for polymerase chain reaction. For cysticercosis, biopsy is the definitive method of diagnosis, but it cannot be performed for every specimen. We can do a biopsy for muscle infection, but if the infection is in brain, then we need other imaging methods for visualization, such as CT scan, MRI, or an X-ray. Lastly, serodiagnosis is commonly employed in case of cysticercosis, where we do ELISA testing. This is a actual photograph showing an egg of tinea in human stool specimen. I think you can appreciate that there is a central oncosphere containing 3 pair of hooklets, and there is an embryophore on the outer side which is radially striated. Third is Echinococcus. The adult form resides in jejunum and duodenum of dogs and other canines, whereas the larval stages are seen in herbivorous animals, cattle, sheep, goat, and horse. Also, humans are accidental host, and larval stages can be seen in humans. The eggs are indistinguishable from tinea eggs, and they are seen in dog feces. It is not relevant to us because since human is an accidental host, adult worm will never be seen in case of humans, so eggs won't be released in the stool specimen. Now, Echinococcus causes hydrated cyst in humans. The most common site is liver, followed by lungs, then kidney, brain, spleen, orbit, and bones could also be infected. A hydrated cyst has 3 main layers: pericyst, ectocyst, and endocyst. Pericyst is the host inflammatory cell reaction, which comprises of fibroblastic proliferation. So it is derived from the host. Ectocyst and endocyst are derived from the actual parasite. Ectocyst is the outer chitinous acellular laminated hyaline layer, whereas endocyst is a very thin germinal layer from which brood capsules will arise. And if these brood capsules get detached and are lying freely in the main cyst, then these are known as daughter cysts. This hydrated cyst is filled with colorless or pale yellow, a highly antigenic fluid known as hydrated fluid. I think first we should discuss the clinical feature of this infection. The clinical features in case of humans are again non-specific. It could either be entirely silent infection or asymptomatic, or the person may experience certain non-specific symptoms such as pain abdomen, especially on the right side. If the hydrated cyst is formed in other organs such as lungs, it could lead to cough, or if it is present in brain, then there could be symptoms associated with space occupying lesion in the cranium. Laboratory diagnosis. For laboratory diagnosis, the most common diagnostic procedure of choice is ultrasound. As we have already discussed, that the hydrated fluid is a highly antigenic fluid, so it is not recommended to manipulate a hydrated cyst. Any cystic cavity in liver is first investigated using an ultrasound. Then apart from ultrasound, we can also do a CT scan, MRI, X-ray, and in case of kidney, we can do an IV pyelogram. Examination of cyst fluid. Once we remove the hydrated cyst completely, we can examine the cyst fluid, or if cyst fluid is aspirated during some procedure, that can be examined. Examination of cyst fluid will reveal scoliosis, grooved capsules, and most importantly, hooklets, which are commonly seen in cyst fluid that we receive in our microbiology laboratories. Again, this procedure is not recommended because of risk of anaphylaxis. Cassoni's test, it is generally asked as a short question in your examinations. It's an obsolete method because it is non-specific. It's an hypersensitivity skin test, and there are other skin tests also that are done in during various investigations. You need to read about those as well. Serodiagnosis has been in vogue during the recent years or the recent decades, in which we will do antigen or antibody detection. The tests are listed over here, but ELISA is the commonest test that is generally done. Again, last test is molecular diagnosis by PCR. This is a photograph showing hooklet in a cyst fluid that I had examined during my MD days. So this is a hooklet. Treatment is mainly surgical. Medical treatment can be done either post-surgical management or in case where the cyst is inoperable. So benzimidazole is the medical management, and surgical management is pair or complete surgical removal. Pair is the preferred method in which we do a puncture, aspiration, injection, and re-aspiration. First the cyst is punctured and all the hydrated fluid or contents of the hydrated cyst are carefully aspirated, taking care not to allow them to spill. Then once the aspiration is done, then we inject a scolicidal agent in the cavity, and after exposing it for a certain amount of time, then again this scolicidal agent is re-aspirated completely. There are different scolicidal agents that we can use, but 95% alcohol or hypertonic saline are the two commonest scolicidal agents that we use. Last is Hymenolipis nana, which is also known as dwarf tapeworm. We have already discussed that it is the smallest and commonest, but it is the smallest tapeworm infecting humans, and it also happens to be the commonest tapeworm infecting us. Eggs are non-bile stained. Till now, all the eggs that we had studied were bile stained. This is the first egg in cestodes which is not bile stained. It is 30 to 40 micron in size. Then it has a thin outer membrane and an inner embryophore, and the space between these two layers has yolk granules and 4 to 8 polar filaments. In the center of the egg, we'll have a oncosphere containing 3 pair of hooklets. This is an actual photograph of H. nana egg, in which we can see an outer membrane, an embryophore, and the space between these two will have a polar filaments, which can be seen over here, and yolk granules. You can appreciate small granules over here. The center portion is the oncosphere containing 3 pair of hooklets. Life cycle is fairly simple. Generally, human are the only host that we encounter. So infection is completed by humans only by way of auto-infection. Clinical features again are non-specific. Either the infection will be asymptomatic or there will be non-specific symptoms such as pain abdomen, maybe certain amount of nausea, etc. Treatment again is praziquantel in a single dose of 25 milligram per kg body weight. And prevention involves good personal hygiene, good sanitation, and also, as we had seen in the life cycle, that fleas and rodents could be responsible for propagation of the parasite, and rodent control is also thus advocated. Thank you.